Welcome to the Mental.Health.Merienda, your snack-sized guide to mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker. So we wanted to do more videos where we give information about different mental health diagnoses and also provide information about treatment. We already have videos on anxiety, depression, and recently OCD. So we'll definitely make sure to link those videos down below.
So for today, we're going to explore attention deficit hyperactivity disorder, or ADHD.
And ADHD is a popular diagnosis on social media, but there's a lot of misinformation about ADHD out there, especially on TikTok. So in recent years, discussions about mental health became really popular on TikTok, where the format allows for easily digestible, quick, and intimate videos that appear in a never-ending feed, right? Depending on the algorithm, you kind of have a bunch of videos at your disposal. And because of the algorithm that TikTok uses, when someone is researching mental health, or maybe they're researching a particular disorder, it becomes really easy to find so many bite-sized definitions, self-assessment quizzes, which may not be accurate. And then it's really nice to have access to different information. But again, there's a lot of downsides because there is a lot of misinformation out there.
Yeah, I think that people just like having access to something that seems very easy. So I've seen so many of these kind of things on TikTok and other social media platforms where it says, take this 5-question quiz and see if you might have ADHD. You might have ADHD if you have this and this and this. And it seems so easy. And I think we, as humans, we like to know about ourselves. Honestly, we like to think about ourselves a lot. And we simple information that's really easy, and so that I think that's very attractive to people.
Yeah, and I especially think those like 5 symptoms that tells you that you have ADHD, or 3 ways you can tell if you have ADHD, like those are also really catchy because you just have to hear like 5 or 3 things, and that seems really easy, like you're saying. But there's more to this diagnosis and any other mental health diagnosis than like 5 or 3 quick sound bites.
Mm-hmm. It's so much more complicated than that. And so mental health providers, they're seeing an uptick in teenagers and young adults who are diagnosing themselves with mental illnesses after learning about the conditions online because of what we were just talking about. But while this can lead them toward getting the help they need, which is great, it can also result in people incorrectly labeling themselves, which could be kind of dangerous, avoiding a professional assessment, or turning to ineffective and inappropriate treatments.
Yeah, even though there's a lot of information, there's also a lot of downsides because of that misinformation. And I think there's also people who are, again, just self-diagnosing themselves as having ADHD or any other mental health condition and not even following it up with a professional to see if it's even true. And then with that self-diagnosis, then perpetuating the misinformation on social media. So again, you just have to be really careful where you're hearing the information from. So ADHD is one of the most common disorders that people diagnose themselves with after watching videos on TikTok. So there's actually a psychiatrist by the name of Dr. Anthony Young who did some research on this. So he and his colleagues viewed some of the most popular TikTok videos on ADHD and found that videos that are posted by mental health professionals contained a lot of useful and high quality information. But most of the videos that are posted on TikTok are uploaded by people who are not mental health professionals, unfortunately. And while those videos tend to be really relatable, very trendy, there was so much misleading information and sometimes completely inaccurate information. So again, we're seeing this done in his research, what we're saying.
And even though it can be really tempting to diagnose yourself on social media because there is a lot of information out there, it's really complicated for a few reasons. First, it's hard to assess yourself. You're not objective when you think about yourself. And so it really takes an objective person outside of you to be able to see the whole picture. That's why it's really helpful to see a mental health professional. And not even just like asking your friend, like, oh, do you think I have ADHD? Because your friend's not objective. Second, the quick format of TikTok videos doesn't really leave room for nuance or exceptions. And so, if you have these symptoms in this situation, it might mean one thing versus having these same symptoms in another situation means something very different. And on TikTok, you have these really quick videos where you can address those little differences. And last is that the symptoms, they're not taken into context. So that's really a big one. For example, experiencing symptoms like poor concentration, low energy, changes in your appetite, or not sleeping well. Those can be signs of depression, but they can also be signs of so many different other disorders just based on what you're experiencing in your life. So that could be burnout, it could be bereavement, or it could even be something like sleep apnea. So you just don't know. You have to take all of those things into context. And so in other words, I think what we're trying to say is that the same list of symptoms does not mean the same thing to each person, and it all depends on the circumstances.
Right. Context is so important. So now that we've talked about why you should avoid diagnosing yourself with ADHD based on what you see on social media, so what exactly is ADHD? So ADHD is attention deficit hyperactivity disorder, and it's marked by an ongoing pattern of inattention and or hyperactivity impulsivity. And all of that will interfere with your functioning or development. And there are three types of ADHD. There's the inattentive type, there's the hyperactive impulsive type, and there's also the combined type.
So inattention means a person may have trouble staying on task, sustaining focus, and staying organized. And these problems, they're not due to defiance or laziness. It's something that it could seem that way to many people.
Yeah, for a lot of kids that I used to treat that had ADHD, oftentimes they would get labeled like, oh, you're just lazy, you just don't pay attention. And then that really, has an impact on your self-esteem. So definitely, people with inattention and ADHD, it's not laziness. It's definitely bigger and more complicated than that.
Yeah. And so a few signs of inattention, and these are not, this isn't an exhaustive list. These are just a few examples. There's many, many examples of inattention, but some of them include making careless mistakes in your schoolwork, at work, if you're an adult who has a job, trouble sustaining attention in conversations and when you're reading during lectures, like at school. Forgetfulness is a big one. Forgetfulness in daily activities like appointments and errands and returning phone calls or text messages and just doing other tasks. And so the person means to write back. The person means to do these things. They don't mean to forget an appointment or to forget to write back, but it's just something that just slips their mind. And full disclosure, I have had times in my life that I've had a little bit of inattention, and I think Michelle can maybe attest to that in our time working together. But it's okay. I'm not lazy.
Understanding. Yeah, no, you're not lazy. And it's not like you don't care about me or anything like that. It's about, again, giving people grace, being understanding. Actually, I've seen people where they actually write the full on text and they just forget to hit send, or maybe something happened in between a couple seconds that then they didn't hit send. So yeah, sometimes that happens. It's not intentional.
No, it's not. No. Seeming not to listen, even when being spoken to directly. And that's another one that can seem really insulting to people, especially in a relationship. Yeah, that could be a really big one.
And kids too, like if you don't seem like you're listening to the teacher, again, you get labeled as being like, not a good student or lazy, again, or those kinds of things. That's pretty common. Yeah.
Finding it hard to follow through on instructions at work or at school due to trouble understanding instructions that are not specific and concrete. So what I mean by that is sometimes in ADHD, it's when you're given a task to do, and it can be hard to interpret what the person means if you're not told exactly A, B, C, and D, and what to do in what order. Something that someone else may think is intuitive, to someone with ADHD, it's not. It requires just that additional step of thinking, and that can be really challenging. Being easily distracted, which makes sense with distractibility as well. Being easily distracted by unrelated thoughts or things going on outside of you, like different stimuli. And this is something I deal with a lot in my job as a neuropsychologist. Is executive functioning is something I talk about all the time. It's a big term that I think we're hearing more about in the media. But with executive functioning, it's a disorganization where you might be disorganized in keeping your materials together, disorganizing your thoughts. So you might get easily overwhelmed by things, and you're not getting overwhelmed because of depression. You're not getting overwhelmed by, for example, having to clean the house because you're feeling really down and you lack motivation. You feel overwhelmed by the task of cleaning the house because you just look at it and you say, I don't even know where to start. And it's hard to prioritize your tasks and hard to know what do I do first, second, and third. But misplacing important items is a big thing about that. So it might be the kind of person who misplaces their driver's license or their wallet or their passport or their phone. I think we all misplace our phones sometimes, but this is the kind of person who's misplacing their phone multiple times per day, every day. So that's definitely, it's another, these are symptoms that I think everyone experiences sometimes. But in ADHD, it's to an extreme level. It happens all the time. It happens not just when someone's feeling incredibly stressed or when they're feeling depressed or anxious. It happens no matter how their mood is, no matter who they're around, no matter what the context is. So that's a big one, is that it's consistent.
Yeah. And I think just kind of talking about the list that you just said of what inattention could look like. Again, if we did like a quick TikTok video that was like a couple, seconds long, and you just list these things out, it could be very easy for someone who's like, oh my God, I'm totally distracted, or I'm totally forgetful. And those are all things that, like you said, like everyone may have some level of being forgetful or distracted. But again, you need that context behind what this diagnosis is to be able to get that diagnosis. And again, you shouldn't do it to yourself. You should go to a mental health professional to accurately get diagnosed.
Yeah, I think it means something completely different to have these symptoms after, let's say, during finals week when you're in college, and if it only happens during finals week versus this happening to you all the time for 10, 15, 20 years of your life. That's completely different.
Yeah. So to define the other terms that we said earlier, so hyperactivity means that a person may seem to move about constantly, including in situations when it's not appropriate, being excessively fidgety. Maybe they're tapping or talking, or they just can't like stop moving. In kids, with kids with ADHD, this is something you might see. So, for example, for young kids, they have to sit on a carpet and listen to their teacher. This happens in kindergarten and in preschool. And sometimes what you'll see a kid who cannot sit still and pay attention. They'll start like kind of crawling around. They'll start like spinning around. They might start bugging all the little kids sitting next to them. That's something that I saw a lot with the kids that I used to treat. And maybe in older, like elementary and like junior high, you'll see the kids that are always getting up out of their seats when they're not supposed to. In school, you do. There's a lot of times where you have to sit down and be still and listen to the teacher. And, they're unable to do that. They're getting up, they're moving their tables. They're always tapping, on their, classmate, who's sitting right next to them and trying to have a conversation with them. So those are some of the things you might see in a child, what hyperactivity might look like for them. And then in adults, hyperactivity may look like, again, being very restless, talking too much, again, that kind of like interrupting, or, you can kind of probably see it in a lot of social settings where, an adult might look like they're hyperactive. So impulsivity means that a person may act without thinking or have difficulty with self-control. So an impulsive person might interrupt others, when you're having a conversation with them, or they might make important decisions without considering the long-term consequences, or maybe even consulting with their partner about, decisions that they have to make together. So that's what impulsivity might look like. For young kids, you'll see, something interests them and they'll kind of like run to it. I've had kids who, because of their impulsivity, they often tend to get hurt. Like they don't like look where they're going when they're, going towards something that they want. Maybe, actually the worst case scenario that I've ever seen was a kid who was playing on the monkey bars and then forgot that, he was, holding onto a bar, and then he like moved really quickly, and then he ended up like dislocating and injuring his arm. So that's an extreme example of, impulsivity in a young person.
That's interesting because even in my assessment of adults, because I do quite a bit of work with ADHD, but I only see adults. But I always have to make sure that it started during childhood, and that's one of the things I'll ask to try to assess that is, were you accident prone as a kid? And the ones that are diagnosed with ADHD, not always, but yeah, sometimes like, oh yeah, I broke a bunch of bones, I had stitches, I had 5 or 6 concussions. And that's always and not, again, it's not diagnostic, but that's a clue that potentially it might be someone with ADHD.
Yeah. And you've been struggling with it since a child, except you were labeled like, oh, you're just like clumsy, accident prone, but it really was inattention, or maybe inattention and hyperactivity and that impulsivity.
And so some of the symptoms you might see in hyperactivity and impulsivity, it might include, like Michelle already said, fidgeting, squirming in your seat, leaving your seat in situations when you should be sitting down, running or climbing at inappropriate times. And in teens and adults, it's restlessness, being unable to play or engage in hobbies quietly, constantly being in motion, being on the go. So just not being able to just sit still, and just like even the example that we both use about tapping. Yeah, tapping.
Yeah, finish that activity. Yeah.
Mm-hmm. Yeah. Talking excessively, interrupting others, like Michelle mentioned as well. And then answering questions before they're fully asked, or finishing other people's sentences and speaking out of turn. So maybe someone's talking and I think what happens a lot of times with impulsivity, with interrupting, which seems so rude, you can see how like socially this could really impede on your social functioning. But if you have something in mind and you know you're going to forget it in a few seconds if you don't say it, what can happen in impulsivity is that the person blurts it out because they want to say it before they forget. Or it could also be that it could seem like they're not listening to the person, but really it's that you are listening to them and you want to show your excitement about how much you like what they're saying. And so you're just kind of blurting out something that's related to what they say. I'm not saying that out of my own personal experience.
Aw.
I just get excited about what people are saying sometimes, and I want to express that excitement. So yeah, so it could seem it's impulsive and it could seem a little rude. Really, that's just a way of showing that I'm interested in what you're saying and I have something relatable to say, and I just can't wait to get that out. So
Yeah. And I think you can clearly see as we're talking about, what inattention looks like, what impulsivity looks like, what hyperactivity looks like, how for kids and for adults, how having one of the things that's a struggle with ADHD is it's going to impact your social relationships or how you interact with others. Because people might mistake some of these, some of these behaviors as, maybe being rude or maybe, oh, you're not paying attention to me. So oftentimes people who are, seeking help, they come in because there might be some sort of poor kind of social relationships that are associated with what they're going through. Yeah. So by definition, and you mentioned this, Adeline, so ADHD symptoms have to be present since childhood. So that's kind of what you're getting at, right? When people come into your office to get a diagnosis from you. But, due to different circumstances, some people don't have ADHD diagnosed when they were children, and they might have to wait till they're adults to get diagnosed into childhood. So again, like there might be some people who, maybe again, they're just labeled being clumsy or they're just labeled being lazy, unfortunately. And instead of, going to see a professional to get it diagnosed and to see if there might be something else going on, they just kind of like lived and functioned in that setting. And then it wasn't until maybe adulthood that they, whatever coping skills that they were working with weren't working anymore for them.
So like Michelle said, for a lot of different reasons, someone may not be able to be diagnosed with ADHD as children, and they don't get diagnosed until they're adults, which is when they might be seeing someone like me, an adult neuropsychologist. And one of the big reasons that I see is culture, because in people who are, especially people who are first generation, second generation, who have immigrant parents, where they don't always have a complete understanding of how things work in the U.S. system, and just navigating that, having to navigate finding a psychologist or psychiatrist for your child or primary care. It's really hard to know for any parent, but even more so for a parent who is not completely familiar with the U.S. system, and just throw in for those parents who don't speak English or that English is not their first language. Yeah, and I feel like culturally too, you're more likely to find immigrant parents who might say, "Oh, they're just being lazy," or "They're just not focused," and that's not ADHD. It's just they just need to work harder. And so that I think that's a big pattern to keep in mind too, and not to judge people for that or trying not to.
Yeah, definitely. Yeah, I think in immigrant households, this is something where just there's not the awareness might not be there, or just not knowing how to navigate this complicated system. It's pretty hard actually, without being professionals ourselves in the system, to try to find like assistance with mental health. It isn't intuitive or straightforward. I'll say that.
And so with ADHD, like we've already mentioned, it's not because there's anything wrong with the person or they had poor parenting or they're not disciplined. And it's not because they have any kind of mood disorder like depression or anxiety or bipolar disorder. ADHD, it's a neurological condition. And it's related to dopamine. It's related to brain chemicals in your brain. So with dopamine, that's the reward center in your brain. When you have ADHD, you either have low levels of it or you have difficulty processing it. But at the end of the day, you don't have enough of it and it's not being processed correctly. And so what that can lead to is trouble with feeling motivated. So that drive that people have and those things that motivate them, when you have low dopamine levels, you don't feel that drive and that motivation. And you might not find certain activities as rewarding as other people might. And so with standard ADHD treatments, including medication, primarily medication, they can help with increasing dopamine to improve those symptoms. So, to receive an accurate diagnosis, you need a comprehensive evaluation or assessment by a mental health professional is key. That evaluation involves interviews and behavioral observations, and it often also includes a psychological or neuropsychological evaluation. So that's what I've been referring to with what I do. And those evaluations are used to rule out any other potential causes and determine the severity of the condition, because a lot of times if you have symptoms of inattention and distractibility, you want to make sure that it's not related to maybe a history of PTSD that hasn't been addressed, that hasn't been treated, maybe a history of depression that hasn't been addressed, or some other bereavement that you might be going through. So many things that can make someone have those inattentive symptoms. But just because you have inattention does not mean that you have ADHD. You could have a lot of other things. A lot of other things cause inattention and distractibility, not just ADHD.
Yeah, all great points. So while there's no cure for ADHD, there are various treatment approaches that can help a person manage those symptoms and improve their functioning. So usually treatments that are successful with treating ADHD are usually a combination of medication and therapy. So for medication, what's going to happen is stimulant medication is going to be prescribed. So some examples of stimulant medication would be Ritalin or Adderall. So those might be the ones that people commonly hear about. So those medications are prescribed to help improve focus, concentration, and impulse control. Now, sometimes a psychiatrist might also prescribe non-stimulant medications. So an example of one would be Strattera. So that could be used in some cases. And it might seem counterintuitive. So why my kid or anybody with ADHD, if they're already like hyperactive or impulsive, like why would you give them a stimulant? But the stimulant medication, it does sound confusing, and maybe because of the naming of it. But what it does is it does help to stimulate parts of the brain that help to regulate the thoughts and behaviors. So again, it's more to stimulate the brain functioning, not so much to stimulate the person's energy or anything like that.
Yeah, that can be really confusing. I'm glad that you explained that. Yeah.
Yeah. And then, so medication is one key way to treat ADHD. And then the second is therapy. So we've mentioned this many times, cognitive behavioral therapy, CBT, is a really effective form of therapy that can help with treating ADHD. And with that, it's really to help a person develop those coping strategies, improve time management skills, or some other skills that can help them cope with some of the things so that they can function day to day. And then as well as address any other co-occurring mental health conditions. So sometimes it might not just be ADHD, but it might be, you have ADHD and something else. And so therapy helps with also managing, those symptoms as well.
So another treatment approach that is really helpful with managing ADHD symptoms are lifestyle changes. So that could be incorporating a regular exercise routine. We've mentioned that a lot. Exercise helps with so many things, and I've been meaning to do it myself. So it helps with
we can
ADHD
all do it.
too.
We can all do this.
Yeah. We can all really focus on that some more. But making sure you have a healthy exercise routine, maintaining a healthy diet, developing good sleeping habits, all of those can significantly improve ADHD symptoms and overall well-being. And then educational workplace accommodation. So it's not just a matter of the person managing their symptoms. In some cases, it's a matter of adjusting their environment so that they can function better. And so with some of the most common accommodations you might see, mostly in school, you see extended time on tests. I would personally say in my recommendations for patients, that's the one I give most often. A quiet workspace, a note taker. So I don't know if that would be something digital. I don't know the specifics of it, but something to take notes for you, or the ability to record lectures. Because, with ADHD, you don't catch everything. So you can take notes when someone's talking, but you miss things. And so if you record it and you go back and listen to it, chances are that the person with ADHD will catch things that they didn't catch the first time. And the use of organizational tools to support their academic or professional success.
Yeah, I think another one that's common in classrooms too might be to have the children who have ADHD like sit closer to the teacher. So, if they're sitting like way in the back in the classroom, they might miss things, as you're kind of mentioning, Adeline. So sitting closer to the teacher. So there's a lot of different accommodations that could be made in the classroom that can help people with ADHD be successful, for sure. So ADHD is a complex condition that affects people in a lot of different ways. So with proper diagnosis, with proper treatment and support, people with ADHD can learn to manage their symptoms and learn to live fulfilling lives. So if you or someone that you love, if you suspect that you might have ADHD or someone you love has ADHD, it's really essential to consult with a qualified healthcare professional for a proper evaluation and assessment. And that way they can also then develop a proper treatment plan for, how to move forward.
So that's all we have for today's episode on ADHD. I'm Dr. Adeline Leon, licensed clinical psychologist.
And I'm Michelle Young, licensed clinical social worker. If you enjoyed our show on ADHD, make sure to like this video and subscribe to our channel so you can get notifications for all of our weekly videos. Also, make sure to check out our other episodes. So again, we have videos on anxiety, on depression. We also have one on OCD. And then we have other mental health topics that we cover that are not just specific diagnoses, but we have videos on relationships and parenting. So definitely make sure to check those out if you haven't already.
And so we hope that you've learned something from this video and have gained something from it. But we would also love to hear from you in the comments. Are there any other mental health conditions that you would like for us to cover on our show? We always love to get comments and any feedback from people on what they'd like to hear from us. So definitely let us know.
And thanks again for tuning in to Mental Health Merienda, your snack-sized guide to mental health wellness. So we'll see you soon. Bye.
Bye.